Okay, we're now live, Chair.
Thank you very much. So good evening, everybody. Welcome to the members of the public who have joined us this evening, those contributing to the event and board members. We've actually got one main item this evening on the agenda, which will prove most interesting and informative. We're focusing on the emotional health and well-being of young people, which is always an important topic for this committee, and perhaps even more so post-COVID. So that's the main thrust of this evening's meeting. However, let's do the introductory admin things. Substitutes, do we have any substitutes or apologies, please?
None received tonight, Chair.
Thank you very much. Members' interests, I need to remind members of the need to declare any disclosable pecuniary interests or other interests they might have in relation to the items included on the agenda. These can you say now, or if and when something comes up, give us a shout and let us know, please. Anything to declare at the minute? No? Good, right, we'll wait for anything.
Councillor Durrans, please, Chair.
Oh, sorry, well spotted. Councillor Durrans, please. What would you like to do?
Just think, because obviously it's a substantive item, I'm part of a steering group for the mental health funding that's going into schools at the moment. So I'd like to declare that now, if that's okay.
Thank you for that. Yes,
Thank you.
Good. As far as the public concerned, it's not recommended the public be excluded from the meeting for the consideration of the items of the business. And in fact, we're running the YouTube connection now anyway, so those who have an interest can watch what's going on. Minutes of the previous meeting held on the 7th of September 2022. Does anybody have any queries, comments in relation to those? Can't see any hands raised on the subject, so we'll assume they're all okay, and I will sign them in due course. Thank you. So item 5 on the agenda is headed Emotional Health and Wellbeing, Co-Production, Integration and Addressing the Needs of Children and Young People in Calderdale. It's aimed at giving the board members an update on the progress to transform support and care for children and young people's emotional well-being and their mental health through a more integrated and system-wide approach, which I think will be a very interesting project and item for this evening. We've been honoured with a significant number of people attending this meeting this evening. From Public Health, we've got Naomi Marquis. From Calderdale ICB, we've got Rona Radley and Kim Brearley. And from North Point, we've got Joe Hannay. Plus, I believe we have a couple of cabinet members. I think Councillor Courtney, Councillor Wilkinson will be joining us if they've not already done so. So we have a very significant group of people here who can respond to questions, comments. So we'll be very interested to have their input to this particular item. I think it's also worth reminding, certainly board members, that we've assumed that board members have had a chance to read through what is a very, I was going to say pretty, that sounds condescending, doesn't it? But a very attractive and interesting presentation there on the slides that we've got. But we're asking officers not, with all due respect to them, just to read through the slides, but perhaps just give us an overview on things and then let us get on with our questions and comments. So we're not expecting a very lengthy presentation, but who wants to sort of kick off the synopsis, as it were, on things? Is that Ben? Are you going to do that?
Yeah, thanks, Chair. Yes, I'll do a brief intro. So you've heard from us before when we've been at previous panels, the impact the pandemic's had on health and wellbeing generally of children and young people, and on emotional health and wellbeing particularly. And you've heard from us before that the impact of the cost of living crisis is going to add to that, and probably even going to be more severe than the pandemic has in many ways. So I wanted to give you that context to start with. We've previously presented information from our school survey, the EHNA, and we've clearly demonstrated that actually children and young people are saying that their emotional health and wellbeing is worse now than it was before the pandemic. And Joe and colleagues, I think Linda's here as well. Joe and Linda will I'm sure verify that when you speak to them, because they see it on a day-to-day basis. What we're going to do today, as you say, Chair, you've had a pretty comprehensive slide pack through. I think previously the focus of these discussions, when we've talked about emotional health and wellbeing, have been very much focused on the services that the NHS commission, and I think to be honest, I think that's a bit unfair on the NHS, because they're not the only people who have accountability for the health and wellbeing and the emotional health and wellbeing of children and young people. Certainly in terms of what happens in terms of services that are available, yes, and that's really important, but actually there's a whole broader range of interventions and support that we do through public health services, in terms of early intervention, but also in terms of prevention and trying to keep children happy and healthy, and also the work that our partners in the other bits of the public sector do, and particularly in terms of education and their role in the emotional health and wellbeing of children and young people. We haven't brought a teacher along with us today. We intend to do that in March, when we're on the agenda again, to get a perspective from education about their contribution globally to health and wellbeing, and not just emotional health and wellbeing, but they'll certainly touch on it when they come along. But we have got a couple of providers along today who are going to give a perspective of what it's like from the front line, and I think that's going to be really helpful. So we're going to start off.
Hey Ben, sorry, on the school side, so will they be able to give us a bit of an overview on the school contribution of things?
Yes, that's the intention. And
wait till the next meeting on this one.
Yeah, that'll be in March, when they're coming along to talk about their contribution across a number of areas, including emotional health and wellbeing. And I think that we intend to, if we can, to have that as a school-led session with support from public health and others, rather than an officer-led session, if that's okay. So today, I think Rona and Kim are going to give a brief synopsis and overview of I suppose a summary of the slide pack, really, and not, rather than going into the detail as you described earlier. We thought you'd want to hear from the front line, so Joe and Linda will talk a bit about how it feels to them, and particularly how it feels in the context of the transformation journey we're on, really. And particularly, I guess, also the impact on children and young people, because that's what we're really interested in here. And then it's really over to the panel, and we'll answer any questions, or we'll try and answer any questions. And if we can't answer them, we'll take them away and come back with answers, as we normally do. So if that's okay, Chair, I'll hand over to Rona and Kim at this point.
You've dropped out a couple of times, certainly for me. So I don't know whether there's I don't know whether people are having a problem. It's not been a problem. I've heard like mostly what you've said, but you've dropped out a couple of times. But please move on to the.
Apologies, Chair. I'm handing over to Rona and Kim at this point, anyway. So.
Thank you. Thanks, Ben. So for those that don't know me, I'm Rona Radley. I'm the Deputy Director for Improvement at Calderdale Cares Partnership. So what was the Calderdale CCG? And my agenda or my portfolio spreads across all age, physical and mental health, but Kim and I work specifically around children and young people services as well. So I'm here with my colleague Kim, who will introduce herself when she comes on. So just a little bit, as Ben says, we don't intend to go through the presentation. I was just going to take 5 minutes to just summarise some of the context in there, and just to say where we've got to following our last visit, or our last visit with Scrutiny last year. So the last year we focused very much on the pandemic and where we were, and the journey that we and services, when I say we collectively, it's us as commissioners, but also our providers. So the journey we'd been on, what we'd learned and what we'd explored, and how we'd got through that process. And although the pandemic seems to be previous years, there's still a legacy around services, especially for children, young people with emotional well-being and mental health on the back of the pandemic. And that's nationally, regionally and locally. So a lot of what we're seeing was not just seen in Calderdale, we're seeing across the region and as well as nationally. So the slides that we did provide you with we shared some of the challenges that are facing children and young people across Calderdale and the priorities that are in place for children and young people and where we're wanting to go our direction of travel for the future. We've talked about Thrive. So Thrive is the concept that we work around for children and young people. And we've continued in our journey of raising the awareness and the training around Thrive and how people access services through the Thrive concept. We've undertaken in the last 12 months more training, and that's gone out to schools and to professionals, so that it's a bit about having that collective and that joined up language and understanding the concept that we're working through. So we've undertaken some training events that have been led by the providers, and Joe might touch on that, but Naomi's been involved in that from public health as well. So it's taken us on a journey to get people to understand some of the changes that have happened across the system and get us working together and working in partnership. And some of that has shown the evidence around improved partnership working in organisations that previously we hadn't worked as a joined up approach. It's given us good lines of communication and a good understanding of that common principle of Thrive. It's allowed us to have that conversation about emotional health and well-being is everyone's business. It's not just one part of the system. And as Ben says at the beginning, what we've done previously is we've come and talked to Scrutiny about emotional health and well-being, and public health have come and talked about children's and prevention and promotion. And actually it's all one, and we are working in a much more joined up partnership way. And I think some of that's come from what's come out from the pandemic and our learning. So it's all about it being everyone's business and how we align the outcomes set in the Calderdale's wellbeing strategy for children and young people. So some of the things that we've done, I just wanted to give a bit of a highlight of some areas where we have progressed and we have achieved in the last 12 months, even though it's been very difficult. So we've been on a journey around choice, and you might remember we talked about choice last time we were here, about the right to choose for people with autism and ADHD, and if you want to use the neurodevelopmental, and the pathway that we've developed in Calderdale in order to progress that. It's been quite unique, both regionally and nationally. We have recruited to a choice care navigator in Calderdale that's established to support families through the process of informed choice. You need to be supported to be able to make that decision, and that's through Joe's service at North Point. And although Liz has been, it's early days and Liz has been in post less than 6 months, I think, it's a really valued post by people, by young people, by parents, by adults. It's across all ages, and she supports and navigates the system for them, because it's a complicated and complex process, understanding choice. In addition to that, in Calderdale, and I think this is what we touched on last time, we've gone through an any qualified provider process. So we've opened up a procurement to invite people into Calderdale, invite providers into Calderdale to work with us under choice, to make it much more accessible for people and to be able to have a list of providers that people can refer to. The difference between mental health and physical health in choice is that we don't have a directory of services for people to navigate, which is really difficult. We don't have it nationally. It's not just Calderdale. This is a national issue. And therefore, we decided to put something in place. So again, something that's unique in Calderdale in order to help and support people to be able to get easier access. Still very early days, but it's something that we've done, and we touched on it when we came last year. We're actually at the end of that process, and we've just gone through the tender process. We're also in Calderdale leading the way at West Yorkshire around the neurodevelopmental pathways, assessment pathways for children, young people and adults. We're looking at what can we do once across West Yorkshire, and then what can we do separately, what do we need to do at place. And I'm saying we're leading the way because I'm leading it. So I'm the lead for those pathways, but I'm championing Calderdale across West Yorkshire. So we're working across Leeds, Bradford, Wakefield, Kirklees and Calderdale. But I'm leading them and facilitating the events that are being held at the moment on the workshops around what's a good pathway, how can we do this differently, what can we do collectively, what can we do individually and at place. Those workshops have we had the first one last week for children, young people. We've got a choice workshop tomorrow, and there's an adult one next week. And then they will progress and go into the West Yorkshire discussions about next steps for neurodevelopmental. We've been working on the local transformation plan, which very much focuses on that early identification, that supporting people, keeping them well, the bit around the bottom bit of the tiered model where we want to keep people well and safe, and people who are thriving. How do we do that? What support is there to support them or to navigate them? So we've had the local transformation for a number of years. It's a pot of money that's provided by was Calderdale CCG, is now Calderdale Cares Partnership. Kim and I have led the process, so we've reviewed all those existing services that are funded from that funding, and have gone through a process where we've looked at lead provider roles, so that providers are working together rather than individually, and coming together and avoiding duplication of services, being much more effective in the way that they work. So North Point have been acting as the lead provider for that. Now, Kim was going to come in at this point and just explain a little bit on that, and she can introduce herself to you all. Kim's a very vital part of the work that we do, so I don't want to steal her thunder on any of this. Kim, are you there?
Yes, I'm here, Rona. Thank you, Chair. Thank you, colleagues. My name's Kim Brealey. I'm a project manager working in Calderdale Cares Partnership. And as Rona said, a main part of my role is working in for children and young people and their families in Calderdale, which I'm very proud to do. So just a brief synopsis of where we are. So we have a number of organisations that have developed projects under the local transformation plan. So we have Healthy Minds, Noah's Ark, Invictus, and then North Point have all had projects that support children, young people and their families. And there's very much a focus on schools. So I think the March meeting is going to be very interesting, where we bring this together with some of the other projects focused on schools. So because of a few structural changes, we have met with all the providers to understand how they've adapted and evolved over time, not least because of the COVID pandemic. And they've all agreed to work within this pilot lead provider approach, where they come together to identify not only how they can support children and young people much more effectively to make sure there's no duplication and gaps, but also there is strength in them improving their partnership working with each other. They've all got different areas of expertise and skills and experience. So for example, it could be around reporting and data and so on. So we're very excited that they've all agreed to come together and to work on an offer, and do that with other partners as well, because they're not going to do that in a bubble. So that's something new, and they are starting to come together. I'm sure that that Jo can talk a little more about that. But it's very much about them taking the initiative and and being able to come back to us to share with us what they feel the offer should be in response to the pandemic and in response to the need for our children and young people. So that's a really exciting development.
Thanks, Kim. So just a couple of more, couple of areas that we've also, we're proud of where we've developed and progressed. The mental health support teams, which are teams that are in schools in Calderdale and trained to deliver specific evidence-based mental health support to children, young people. Started in the pandemic, and so it's been difficult, but they have really progressed in the last 12 months. They are the focus for those teams are to support children, people with mild and moderate needs across a number of schools and colleges. So we've got 2 different pilot schemes that are running over different years and at different phases. There's a commitment from commissioners, and we had to make this commitment that funding of this additional service, complementary service, which is to other existing support, would not affect the funding elsewhere, and we've had that commitment. So this is dedicated funding that's gone into those schools and that support system. And then we've got we've invested with North Point. We were part of a pilot actually a couple of years ago on the personal health budgets for young people, and we've developed a process where for people, the young people that we identified as part of the personal health budgets were people who were being excluded from school. Either they weren't going to school themselves or were excluded, and sometimes there's to understand the reason and what support and help that they could get. So we've had a number of young people that have been part of that project. We have a navigator that's recruited to support those people, an individual that is absolutely fantastic at working with these young people. We've got some audios that from the young people to explain the help and support that they've provided them to get back into society. Some really good outcomes which we could share with Scrutiny members if they want to hear those, but really something that really makes it, you can see where the difference is made just from an individual input into supporting those people. So the things we want to move on to, and the things that we're really focusing on now moving forward and out the pandemic. Oh, I just wanted to say, sorry, in addition, we've cleared the waiting times for the early years autism pathway, and that's down to 3 months, and that was at 18 months prior to this. So we've focused on that and got a clear pathway. And that was, some of that was on the back of the discussions we've had with yourselves last year and the request. So just moving on to where we're moving to. So we're looking at an integrated single point of access, and that's working with Ben's team, or should I say working with Locala and North Point to actually start to look at how do we provide a holistic assessment pathway across physical and mental health. Currently, our first point of contact looks at just the mental health element, and the local school nurses are looking at the physical health. Actually, we need to join them up. It needs to be holistic, and we need to do that together. So we've Ben's team and our team and the providers have been working together to start to understand what that would look like and how we implement it. Still early days, but our plan is to have that in place next year, early next year, first quarter of next year. Shall I say spring next year? And it gives young people more choice and control and flexibility over their healthcare. So that's a really positive bit of collaboration, working in an integrated way across our systems and ensuring we've got the right services in the right place and reviewing our services to keep looking at where we can improve. We've got strong local leadership and a real commitment and passion to take this agenda forward. We continue, as I say, to deliver on the delivery and the maturity of the Thrive principles and the element of it's everybody's business. We've got, as I say, integrated working between public health and health commissioners. And we're on that system transformation journey to join things up and work together. We're focusing on prevention of children, young people and families, and them telling their stories, wants, and how organisations work more closely together and in partnership to help that happen. And then we have a part of it, well, Ben will be able to explain this more, but we have family hubs in Calderdale. It's new, it's innovative, it's something that we're all joined up and working in partnership on, but primarily it's focusing on the early years, but covers 0 to 19-year-olds, and the scope does include the emotional well-being and mental health and perinatal health support. There's more to say on all of that, but that was just a bit of a flavour of where we were, where we have got to, and where we want to go to next as direction of travel. I'll hand back to Councillor Evans.
Thank you very much, Rona and Kim. Thank you for the sort of overview aspect of that. That's very useful. I think that it would also be useful, perhaps, you've referred to Joe, or referred about Joe and his sharp end of things being involved there. I'm just wondering, Joe, from your point of view, with this very welcome move to a more coordinated approach, how well you feel the system's working, what bits are working, which are perhaps not working and need more attention, those sorts of aspects I'd certainly be interested in. So, that and anything else you feel you need to contribute at this point.
Of course, yeah, happy to. Thank you, Chair. So yeah, I'm Joe Hannay, Head of Services for North Point Wellbeing. We're a third sector provider of mental health services to children and young people and adults, mainly in Leeds and Calderdale, but other parts of the region as well. So in terms of what wasn't working well, the Open Minds CAMS first point of contact that we provide, which is the single point of access for referrals into mental health services in Calderdale. That was receiving some people might know it as the FPOC. That was receiving a huge number of referrals for children and young people whose needs could have been much better met at an earlier stage by other parts of the system. In particular, we were getting lots of referrals for low-level need. Referral pathways weren't working particularly well. They were working well within the Open Minds CAMS mental health services, because we've, as Rona highlighted, we've made tremendous progress there. But in terms of externally with referrals and schools and school nursing, things were being missed, and that situation was resulting in delays in the system as children and young people waited longer than necessary on occasion to access support and signposting. Parents and carers would tell us that they felt frustrated, that they had to keep telling their story to different people, and it also meant that young people were only being treated for the particular presenting need that they'd been referred with, rather than a more sort of holistic, rounded approach that input from school nursing colleagues would have been able to provide. It also meant that those who needed specialist mental health support were on occasion having to wait longer to access that because of how our resources were having to be allocated and diverted. So we've taken a number of steps as a partnership to try and address and improve that situation. We've consulted schools and talked to them. They told us that they were confused about who to contact and how, especially after the as we face the aftermath of the pandemic, and they also said they wanted the system to be more joined up. They wanted to have a better understanding of when and how to refer to mental health services and other services, and what they could do themselves within school as well. So we agreed to move towards a much more closer working arrangement with other parts of the system and school nursing in particular. And as Rona's highlighted, we knew this type of approach had already produced very positive outcomes within Open Minds mental health services. We're all now working within the Thrive framework, but that conversation hadn't really had the opportunity to extend to other parts of the system. So practically, in terms of what that looked like, we've implemented regular catch-up meetings between providers and commissioners, where we can have a much more open and honest sort of dialogue and work together on an equal footing to try and find solutions to the challenges. As an interim immediate the pilot measure, we introduced regular case discussion meetings with frontline practitioners and particularly from school nursing and Open Minds CAMS and managers, where we looked at the referrals for individual young people and thought about how we could work together to meet those needs. Naomi and Kim led on communication with schools and the wider system about the approach that was being taken and about the support that was immediately available and in a lot of instances. And we've been able to join in other partners into that conversation through the lead provider work that Kim mentioned with third sector colleagues and with the mental health support team in schools that we're also involved in delivering, and with NHS colleagues like Linda from Swift, who've already got a tremendous experience of joint working with public health colleagues in Kirklees and elsewhere. So this has enabled us to look together at gaps, expertise, how we deploy our resources, and about who's already got good links in with schools, with different community groups, and what strengths we've got as a system. We're also having much more strategic joined up discussions where we've been able to give a perspective on how we think things can be improved. So on the ground, that's leading to some very clear and tangible examples of young people getting better access and immediate access to the help that they need. It's helping the staff teams gain a better understanding of the benefits of this type of approach. They're reporting that they feel more skilled and confident, and we know that bringing staff with us on this journey is an essential factor. So it does feel like we're moving away from an approach that's focused on rigid service remits and boundaries, and one that's much more focused on the right support at the right time, at the right place for children, young people and families. We've also been able to show schools how we've responded to their needs and requests. We've delivered training, we've provided sort of consultation, we've gone in and helped them think about their particular issues in their schools and their communities and their upskill, help them upskill their own staff. We've got some fantastic examples of how the personal health budgets and that personalised healthcare approach has helped individual young people who've one's recorded a song. Some have come out of their own home after long periods of months and years of isolation. Others have returned to school, and some young people have been able to support other young people. I guess we're it's fair to say we're very excited to be part of this wider transformation journey. We're not there yet, but we've very much welcomed being involved as a provider and being heard as we can work together to plan the new delivery model that Rona and Ben were talking about. And it feels as there's some really good momentum built up, and of course there are practical challenges, IT systems and competing demands and expectations, increasing volume of referrals, but those things feel more manageable now that we're taking a more collaborative approach. My colleague Linda is here from South West Yorkshire NHS Trust as well. I didn't know she.
I mean, that sounds very good, Joe. I mean, so you're confident the system is working, the new system is beginning to work well, and you don't see any particular areas which need addressing along the way?
Feels very much that we're clear about what those challenges are, and that we've got that spirit of collaboration to be able to be able to address them, and some good examples of how we already have.
Okay. Thanks for that. I think I'm in danger of hogging this one. So I think what I should do now also is to recognise that we've got a couple of other people who may well be contributing. So please, contributors, you want to go along. Ben, do you want to have any more input, or shall we look at some questions from members now? Feel you need to say anything more at this stage?
Chair, I wonder whether it's worth seeing whether Linda wanted to come in before me, just as a follow-up to Joe's answer.
Okay, Brenda, I'll come on to you as soon as we've done that bit. And anybody else has got the hand up. Yeah.
So is it over? Hi, I'm Linda Moon. I'm General Manager for Specialist CAMS in Swift as part of Open Minds. And really, I just want to add on to what Joe was saying about sort of, the improvement of partnership working, how it's working better. And really, to give you an example, is certainly over the pandemic, we have seen a threefold increase in young people going into crisis. And, the numbers coming through both for crisis and for eating disorders have been unbelievable. And it's something that, our crisis team have struggled to deal with. And we had a situation earlier on this year where the numbers again were just skyrocketing. And when we were trying to deal with them in CAMS, again, like I say, our capacity was stretched to the hilt. So North Point and their duty people were starting to help us out. But what we realised quite quickly, certainly talking to families, and North Point again talking to some of the families, is that actually families were being sent to A&E. From schools, a young person may have raised sort of a risk or an issue, and they were being sent straight to A&E. And some families were telling sort of North Point, actually we didn't particularly want to go, but school was saying, no, you need to take them to A&E. They self-harmed 4 days ago or whatever, and you need to be doing this. So, for us, these were not appropriate referrals for crisis. And like I say, the fact we were getting 8, 9, 10 in a day, where, even on our busy days, we're talking 2 or 3. So what we actually did was we wanted to try and understand why schools all of a sudden were sending people to A&E. So working alongside North Point and our MHST colleagues and the staff that go into schools from the partnerships, it seemed to be that schools' policies, or whether schools had forgotten the actual right pathway. So obviously North Point helped us reiterate the fact that if you are concerned about a child, there's people at the end of the phone in FPOC, there's our duty people, but also they went in and with Invictus as well, another one of our partners, went in and did training for schools. So, to talk about self-harm, to talk about sort of suicide, to talk about risk, and when, at the different, red, green, amber levels, when you need to send somebody to A&E. And that has had a really positive effect in that the numbers have reduced. We couldn't have possibly carried on the numbers coming through. Our crisis team are swamped as it is. But to me, I just wanted to raise it as a really good example of how, talking together, understanding the situation, but then looking at who's best placed. The people that went in to do the training have really good relationships with schools. North Point, again, we're able to talk to families. So to me, I just wanted to raise that as a really good piece of work that shows, one, how far we've come all together, but also the benefits of actually working together.
That's very useful, Linda, because I think that critical area, the link with the schools, is by definition a critical area, and clearly if schools don't have forgotten or don't know how to approach things, then this training and working with them is wholly important in relation to this more group way of working. So it's good happening. Thank you for that. Much appreciated. I'll go on to some other board members' questions. Brenda, you, I think, had your hand up first. You've got a question for the officers?
Yes, thank you, Chair. It's in relation to your presentation, your slides. I think it's about the fourth slide in. I find the presentation, although it is very colourful, I find it extremely confusing. And certainly the fourth slide, which appears to be a dashboard that is using a colour coding red, green, amber, which I'm used to seeing as a RAG rating. And I don't know whether that's how I'm supposed to be interpreting it. And I don't know whether I'm supposed to be looking at it from the outside going in towards the red, or from red going out towards the lilac. I don't know whether somebody can explain to me what this is supposed to be about, because I can't see the connection between agriculture and food producers and children's mental health.
I'd be interested to hear their answer to that. Can somebody do that?
Would you like me to? Sorry, Ben. Would you like me to just start off on that one?
Yeah, fabulous. Thanks.
So thank you for the feedback, Councillor Monteith. So this particular slide is meant to be a snapshot which illustrates some underpinning national issues that are also affecting us here in Calderdale. And that particular image, and I will take that feedback on board, is meant to illustrate, so it's an image that's used in a number of sources. So that image is meant to illustrate some of the social determinants that affect the well-being of children, young people and families. It links back to this conversation that a young person's emotional well-being and mental health isn't necessarily just affected by one issue, but it could be affected by multiple issues linked to the social determinants, which Michael Marmot talks about quite a lot. So it's not a dashboard, it's probably an image that maybe can be interpreted in that way.
Thank you. Danielle, Councillor Durrance, you have your hand up.
Thank you, Chair. Can I just declare another interest, because I'm sorry, I didn't think about it at the time, but I'm one of the committee members for Calderdale National Autistic Society and do attend the steering group for the neurodiverse work as well. I've got a couple of questions and comments that probably link, if that's okay to raise, Chair.
Yeah.
I think along with Councillor Monteith's comment, I wanted to ask around that, because whilst going on to one of the other slides around the impact of children in the north and the worser impact that our children experience around their mental health and their life chances and how that is. And one of the comments around Mind have said 88% of young people have said that their mental health has got worse. I just wonder, how do we locally, in order to deliver a really well-valued and personal approach, understand which of those areas in that rainbow are affecting our young people, because we know the impact overall in the north, and we also know that 88% have said their mental health's got worse, but do we know what our children think good mental health looks like? Do we know what they feel are the challenges when they're coming through? Are we making assumptions because they're from an area that we know has a higher level of deprivation? That sometimes that doesn't always affect people. If everybody that you live around is the same as you, it might not necessarily negatively impact your identity. And I just was wondering about often how much are we actually driving down into the young person's identity views, and how much is personalised locally compared to the national picture, if that's making sense.
Would you like someone to answer that point first, if you have another one?
Yeah, I think that might be better, if that's okay, Chair, and then I can kind of separate it.
Lose the thread on it, if not. So who would like to come back on that?
I'll make a start on it, if that's okay, and then I might see if any of my colleagues want to add to what I've got to say. So I think just in terms of the first bit of your question, all of those factors on the slide 4 that's coming under a lot of scrutiny here, all of those factors are contributory to emotional health and well-being. I think the primary factor that our families, our residents are saying is causing the most concern at the moment is cost of living, and that clearly has an impact. The having enough money clearly has an impact on children and young people and their development. But don't forget also that we've sort of come out the end of the pandemic as far as the education bit is concerned, and we're in recovery, but we've had children who have felt quite isolated over the last 2 years at times. And certainly during lockdown periods, that's been very challenging to, I think, a number of our children. And that's not about where they live or whether they live in an area that's more deprived. That's something that cuts across Calderdale as a whole. In terms of how do we know, are we doing personalised care? I think Joe sort of referred to this a bit earlier on, in that the approach very much, and Rona did too in her presentation or in her intro, very much around doing the right thing for the individual. So what makes children and young people have hope and aspiration, which is what our outcome is in Calderdale in the wellbeing strategy. That's the outcome we're striving to achieve. Well, being healthy physically and emotionally, mentally is a key driver of that. And some of those things I've talked about before are key drivers of good physical and mental health. So within that then, there's some work going on to understand, co-producing with children and young people to understand what hope and aspiration means for them. And what does that mean in the context of good emotional health and well-being? And that's really important, and that's part of the work that's being done through the Developing Well partnership, which is part of our structure around delivering the wellbeing strategy. So I think there's some things we know through the current service delivery, and we tend to know that about people who are hitting services, but more generally, do we know what hope and aspiration means for all children and young people in Calderdale? We probably don't. And that's the work that we're taking forward as an aside to this, but to help us inform what we do in Calderdale to ensure that we have an environment that enables children to have hope and aspiration and deliver on them achieving their ambitions for life, really.
Thank you.
Does anybody want to add anything to that? You don't feel you need to, that's fine. I just didn't want to keep quiet. Danielle, you had a second question or a follow-up, I think.
I did, but actually Ben answered it, because I was asking about the co-production with young people, and you said that that's some work that you're going to do. So that was my next question, really, around the impact on how they feel around it and what they can offer, particularly if they've been in the service. So thank you.
They're also mind readers, it would appear, as well, which is very impressive. Thank you.
Chair.
I've got Felicity and Dot. So Felicity first.
Sorry, Chair. I think Rona just wanted to come in, if that's okay.
Yeah. Sorry, I missed Rona.
No, sorry, I went to put my hand up. I can't find my hand to put it up on the screen.
I'll find your hand.
I'll have to do it virtually and wave to you. I was just going to say on the back of that, there is the co-production through the Developing Well group. And in addition to that, Danielle, we're going to be doing some involvement with young people around emotional health and mental health. So that will be coming up in the next 6 months. So there will be a piece of work that we're doing collectively as well to link in with that, but directly from to do with the emotional health piece of the jigsaw.
Thank you. Yeah. Sorry I missed you there. Felicity, Councillor Issett.
Hi. Just want to say thank you for all the work that you're doing with the young people, because working with young people myself, I totally understand the impact the pandemic has had on their mental health. So it was really lovely to see all the work that's going on. Mine's a slightly obscure question, just because I knew that this agenda item was coming up. So I did a little bit of sort of research this weekend and started looking at the mental health signposting things that we were doing, and got onto the Open Minds website, which is really, really good because it points in loads of different directions, and is really helpful for young people and really easy to use on your phone, which is good because we know that's what young people sort of live through these days. My only concern would be at the minute is anyone considering the signposting that we currently have to mermaids, which is on the I Need Help, I'm Under 17 page, because obviously there's quite a significant amount of safeguarding concerns around that charity at the minute. And for example, the DFE, have currently withdrawn all their signposting to mermaids in their literature in the last couple of days. So I just wondered if somebody was sort of looking into that at the minute.
Interesting. Can anybody respond to that?
A response from me, I think, start with it. I wasn't aware of that, and that's really helpful to know. And given you've raised those concerns, then we can take that away and do something about it. I don't know if any of my colleagues were aware of that. It does highlight why we need to be so joined up and working as a partnership on this, doesn't it, really? So we find out what's going on outside of perhaps the clinical bit of the world, but and look at what's happening a bit broader. So if DFE have done that, then we'll take that and take it away. Is that okay, Rona? Yeah.
Good. And thanks for
Thank
highlighting.
you. Told you it was a bit of an obscure one.
Yeah, well done, Felicity. Thank you for that. Brenda, is that a legacy hand or is that a new one? Okay, I'll carry on. Councillor Foster, Dot, you've had your hand up waiting patiently.
Thank you. First of all, thank you for this. There is a huge amount of information in the slides, which, as others have said, it's not always the most easy to navigate, but overall it's a really helpful lot of information. Firstly, a comment. I'm really, really pleased to hear that autism assessment times are down so significantly. They were horrific at one point, way beyond where they ought to have been, and it's really, really, really pleasing to hear that they're down to, is it 3-4 months now? That's much better. That gives parents hope. Because I know quite a few parents have been really traumatized by the fact that they just haven't been able to get anywhere near a diagnosis for their children. I've got sort of 2 questions really. One is, you mentioned the choice in neurodiversity. It's on page 26, if that means anything. Page 26 of the slide pack. I just would like a bit more information about that choice in neurodiversity, and what that is and what it means. And also, girls are significantly underrepresented when it comes to autism diagnoses. And this isn't because girls aren't autistic, it's because girls aren't noticed to be autistic. That it's picked up as other things. They've got anxiety, they've got, sort of all sorts of other behavioural challenges and issues going on, which then are not recognised as autism and not even investigated as autism. What are you doing to ensure that girls aren't missed in the autism assessment process? Thank you.
So this feels like might be one for you, Rona, in terms of the neurodiversity, if that's okay. And you may have something to say about the autism as well, but if you haven't, then somebody else will.
Yes, that's fine, Ben. Thank you. Thanks, Councillor Foster. We will take that where you're pleased around the waiting list. I do have to say it's for early years that we've reduced that waiting list. That hasn't been replicated yet in the other areas, but it's our next step. So we've started at early years and reduced that significantly down to 3 months. But thank you for that. Choice. Now, that's a really complex one and very hard to explain that in the time we have. I could take the whole time of this session to go through that. But in a nutshell, the principle is that people have a right to choose their provider for an assessment for neurodiversity, so for autism or for ADHD or joint as an ND assessment. They have a right to choice. There's quite a few complex issues that follow that. They have to be clinically appropriate, and that can be through their GP or through the first point of contact. So the GP can either decide whether somebody is clinically appropriate and refer, or the GP can refer to the first point of contact, or the person can go direct to the first point of contact to get an agreement as to whether they're clinically appropriate. Once deemed clinically appropriate, that individual then has the right to choose where they have their assessment. But it can't be just anywhere. It's got to be with a provider who has currently a contract with any commissioner. So what was Calderdale, what was a CCG, any CCG in the country. And the problem we've got with that is we don't have an electronic record system like we do for physical health. When you go to your GP and they look up who the providers are, and they've gone through the due diligence to be on the list to be able to provide that service, that's not available. So we don't know which providers have got contracts. So we have to do a search. So that takes some time. But in general, the person has choice. If they choose somewhere, we have to check whether there's a contract in place. Once that check's been deemed it's in place, the person can then be referred, and that will be paid for by the NHS. So they don't have to go down the usual route of the service we've commissioned for Calderdale, which has been North Point and then into Swift as part of the Open Mind service. That's still available, but there is a right to choose for people. And the navigator role, the lady's called Liz Marks, is there to help people to navigate through that system, because it is complicated. People don't know where is available. They don't know how safe a service is, what the quality is of that service. So they need that support and that help to make those decisions. And then if there's any impact on that in respect to ongoing treatment, if they get a diagnosis, and where do they receive that? So there are different nuances towards it, but that's the principle, the right choice. I don't know about the girls being underrepresented for in autism in Calderdale. Oh, Ben does, by the sounds of it. So I'll hand back to Ben.
Yeah, so there definitely is quite a big differentiation between diagnosis in girls and boys, and Councillor Foster's right to point that out. That's linked largely to girls present very differently to boys on the whole with their autistic traits, and that can make it harder to diagnose. I think what I would say is there's lots of work going on, and Rona and colleagues particularly involved in this around the pathway, also for autism. That's right, isn't it, Rona? And to ensure that we do it as well as we can. And part of that, I think, and we can certainly go back and I think check that this is happening, because I'm not centrally involved, it is happening, is that we get the diagnosis bit right. And I think previously there's been some challenges around that. That's not a criticism, it's just really difficult. And I know there's lots of people working on it to make it better, but I think that narrative around ensuring that all children receive the diagnosis they need is really important, and recognising that it's not a one size fits all for boys and girls is important in that too. And we can certainly take that back and feed that into the discussions, but I'm pretty sure that those discussions are already happening. Rona would know that better than me. She's a bit closer to it than I am, but again, that's around, I know the discussions have happened around making sure we meet the needs of every child. So you would expect there then to be a discussion around, are boys and girls different? Are we doing the right thing? But we'll make sure that's happening, Councillor Foster.
Kim, you've got your hand up. Did you want to come in on that item? Please, I've got Diana and Helen as well to pick up, but I thought it'd be useful for Kim to come in on that.
Yes, if that's okay, Chair. So I've lived and breathed the Calderdale any qualified provider procurement for some months. And so I just wanted to share two things. So Rona mentioned that Calderdale is front and centre in some of the West Yorkshire neurodiversity work. And that we've already been to led one workshop, and it's very interesting to hear clinicians who from across West Yorkshire who are clearly cited on this particular element. It has come up in table discussions, but just to share with you that the specification, the Calderdale offer that we've advertised out and asked providers to come into Calderdale as part of the tender, that specification does say that we expect providers to use nationally recognised evidence-based diagnostic methods that take into account that are gender sensitive and take into account that very fact that girls, boys and adults may present differently. So it is included in the Calderdale specification.
Thank you.
Could I just sort of just come in there to say that our staff are very well trained, and obviously you're right to raise it. There is a big difference between the behaviours of a girl with autism and the behaviours of a boy with autism, and we are starting to see more increases in girls being referred. And I think, I agree with what everybody said. There's a lot of work to be done, but certainly, we are seeing an increase in girls being referred and girls being diagnosed. And like I say, we do make sure all our staff are very up to date with appropriate training. We've had one of our sort of psychiatrists doing training around autism in girls and the differences. And like you say, it does get very much sort of missed at times because they do tend to be quite quiet and anxious or whatever. But I just wanted to stress that we certainly when we get new staff in as well, make sure that they're fully aware of the differences when they're doing when they're following the criteria.
Thank you for that, Linda. Appreciated. I've got Diana, Helen, Dot. I think Brenda wants to come back in again as well.
Come back in on that specific point, Ashley, if I may.
Right, okay, yeah.
Okay, thank you. Yeah, thank you for your responses on particularly on the autism side of things. I think it's one of those things where it is better than it was now, but before. It is better now than it was before. But for girls, women in their 20s, for example, they're in a position now where people are saying, oh, has anybody said to you, you might be autistic? And nobody has ever had that conversation with them while they're at school. There's all sorts of other stuff being picked up, anxiety being a big one, but that has never ever been a conversation that's been had while they were at school. And now they're in the 20s, and I know of at least 2 or 3 young women that this applies to, and they're struggling. They're really, really struggling to get the support and the help that they need. So I think it is really, really important that girls aren't overlooked, and I am reassured to some extent, at least, by what I've heard this evening. So thank you.
So I think people have given a commitment there to check it out, which is good, and thank you for raising it. Diana, Councillor Tremaine, you've been patiently waiting.
Yeah, I'm sorry, I've got my video off just because I've had weird connection problems tonight, and I don't want to disappear entirely. Yeah, it was more of a comment actually, just from listening and I found it really, really interesting, particularly hearing from Joe and Linda and getting some of the detail of, you know, exactly what's been going on and the impact on young people. And I was just thinking for sort of future, the next time you come along, it would be really, really valuable, I think, to kind of capture some of that in a bit more depth in like I don't know, mini case studies or something where we really kind of get the sort of child, the young person's voice coming through a bit more from them directly, because it you know, I could sort of tell that, you know, you were talking about stuff that was obviously having a really important role and helping them to make big changes. So it'd be lovely just to hear a bit more of that in the future. So thank you.
Good point. Thank you for that, Diana. Helen, I think Councillor Riveron, you've been waiting very patiently for some time as well. Yes, you've gone on and off. You're still mute, I'm afraid, Helen. That looks better.
I think no, it's okay, Chair. I think the point's passed. I won't want to raise the points about sort of girls and assessment. I think it's been dealt with. Thank you.
Okay, that's fine. I just wanted to make sure. Thank you for that. Brenda, you had another question, I think.
Yes, thank you, Chair. And sorry, I couldn't get back to you. I can't seem to get my chat to work. So I wasn't able to respond to say, yes, it was another question.
Right.
I don't want to sound overly negative, but we are supposed to be scrutiny. So perhaps some harsh comment or questions are appropriate. My heart sinks when I hear people talking about co-production of reports or assessments or anything like that, because from my experience, that means that nobody takes full responsibility for the case or the young person or the action. And it results in people saying, oh, well, I thought social care were doing that, or I thought health were doing that, or I thought education were doing that. And in fact, nobody's doing anything.
Okay, so Ben, you look like you might be able to allay fears on that one.
So I understand that concern completely. The key to this, I think, is having a lead worker working with that family and that child, and that doesn't have to be necessarily someone from Joe's team, for example, or someone from Linda's team. It could be a school nurse, but or it could be someone in social care. Their role is to be that care coordinator, and I agree, if you don't have that care coordinator, then it's everybody's problem and nobody's problem, isn't it? That somebody has to take the lead on it, and someone has to be that person who is going to coordinate the care for that child, and that's really important, I think, and underpins the approach that we're trying to do in Calderdale. If that helps, Councillor Monteith.
I hope that does. I hope that does. Can't see any other hands, can I, at the moment? Sheila, you've got your hand up there. Sheila.
Yeah, thank you. Speaking as a retired teacher and, you know, working with school nurses throughout my early career, but unfortunately that sort of got less and less the opportunities to do that. And I just wondered where it talks about the repositioning of school nursing as a first point of contact, what will that look like? What does that involve? Does that mean school nurses being more readily available in schools as they were before? I can't envisage what that will look like. Thank you.
Naomi, do you want to come in on this one?
Yeah, absolutely. I just put my hand up to do that. So the model that we're trying to move to going forward, Sheila, is to get back some of what school nursing used to be. Public health nurses, which school nurses are, as you will know, are uniquely placed and uniquely qualified in the system to do that holistic eyes on, to do that what's going on for this child. So not just treating a presenting issue, be that physical or emotional, but looking at what's going on at home, looking at what's going on in that child's world, and looking at what the best professional is to support with that. We can never bring back school nursing as it was years ago. But what we're trying to get to a point of is where school nursing is front and centre in our local model. Doesn't mean the school nurse will always be the lead professional for a child. Doesn't mean that all children will need a full health needs assessment before they're rooted into the right bit of the system. But it means that we can make sure that things aren't being missed, that as part of that first point of contact going forward, so the holistic first point of contact, we've got that eyes on. And as Ben said, moving towards that model where we've got a lead professional, a care coordinator, who might not be a health professional at all. It's whoever the right person is for that child and that family. And sometimes that's somebody in school. Yeah, it could be a head teacher who's very well known to the child and knows the family and is trusted by the family. And that bit is really important to me, actually, that whoever the lead professional is for a child isn't just based on what their health needs are, but on what their needs are and their preferences and their family's preferences. And then we back that professional up with all the expertise we've got in the system in terms of making sure that the child gets everything that they need. And that sounds very, very idealistic, but that's the model that we're moving towards.
I like that sort of ideal, as long as it happens. Sounds good to me. I just remember the knit nurse, showing my age now as well, coming to see us and sort us out. But there we go.
Can I just say that sounds quite interesting, because I never could understand why schools weren't utilised more, because generally, you know, especially primary schools, your parents are around and the children are around at least twice a day when they're bringing and taking children to and from school. So the more that schools and school nurses can be utilised, I think the better things will be. Thank you.
Thank you for that, Sheila. Ben, I think you want to come in on it as well.
Yeah, I just wanted to add, following the discussion we had earlier in the week, really, that Public Health have made an offer to come along Scrutiny to talk a bit more in detail about public health nursing, so school nursing and health visiting and what they do and how they contribute to the outcomes of children and young people. So if that would be useful to you, we can schedule that in. And I think that's part of the discussions for the next agenda item, isn't it, Chair? But yeah, it's come up a few times, hasn't it? This role of the public health nurse, and it seems to be something of interest to the panel. So we've made that offer.
Good. Yeah, received and noted. Thank you for that. I've got a question which I've jotted down here. There's been no specific reference to the BAME community in all of this. It may be utterly irrelevant to feel that we have to talk specifically about one part of the community, but are there different issues, different problems with that community? Are there language issues? Are there cultural issues in terms of coming forward or accepting help in these mental health areas? Is it something we look at? Is it important?
Sorry to do this to you, Joe, but I wonder whether, Joe, Linda, whether you would have a perspective from the front line on this. I think it'd be really helpful.
Whoever would like to respond.
Certainly from our perspective as the organisation that's trying to make mental health referrals, I guess, more accessible, it feels very important. I think there's quite a few different things in here. It's we're doing perhaps the figures that more recent figures in terms of referrals, and this is just into mental health, from Black and minority ethnic communities are perhaps more representative of the local community. What I also think is interesting is the proportion of people who go on to access treatment as well, which isn't as representative. Now we know that some other of our partners, like Cooth, for example, sort of online confidential out of hours and weekends online digital support is their figures are in terms of who they support and who accesses their service and when and how they access and what times. It's very detailed and they seem to be doing a very good job at engaging with people from different groups, and of course we could look at lots of different groups who might experience sort of, I guess, health inequalities as well. And one of the briefs of the mental health support team in schools as well is to try and look at exactly this type of issue. What prevents people from accessing support? Are people getting it elsewhere? What stigma, what barriers are there as well? But it feels like there's a lot of learning to do. So we've come some way, and there's perhaps things to learn from some other partners as well.
I just feel it's an area that maybe we're not taking sufficient note of. Perhaps that's something we could look into, Ben, in this area, if you feel it's appropriate, if it's necessary. It was just something I was aware that wasn't mentioned.
I think we could be more explicit about it, and we'll make sure in the next time we come to see you, we do have something in that. I do think it's something, inequalities is really important to the people who are working on this agenda, and clearly ethnicity is part of that discussion and important to us in Calderdale, given our population. So it's not that the work isn't going on. I think it's probably that we just now haven't articulated it well enough, and we can do that in the future.
Yeah, thank you. Yeah.
Councillor Fazal has a question, please.
Yes,
Chair.
yeah, I was just saying that. Councillor, please present your question.
I think that's a very important topic that you raised in terms of ethnic minorities. We do need proper figures. And also I want to know whether we have any employees within these organizations from the ethnic minorities, from a similar background, culture. Because I think that's very important, that those people at the forefront have the relevant skill set to deal with people from the ethnic minority. That's extremely important. And that can only happen if there are employees from a similar background.
Mohammed, we had difficulty hearing some of that. Joe, did you pick up enough to be able to respond to the question?
Let me try again. I think this was due to my headset.
Yes.
Yeah. Sorry about that, guys. I think it's a very important question that you raised, and I think we need to know as to how many employees there are within these organizations that are from the ethnic minorities. Because I think having people from a similar background does help in terms of culture and language barriers in order to help the BEAM communities within Calderdale. That is very important. And if the officers can enlighten us as to whether they have numbers as to how many officers there are from the BEAM community within these organizations.
Yeah. Does somebody want to pick up the hot potato? Ben, you're waiting, I think.
Yeah, I think it's, I don't think we've got that at our fingertips, but I think what we can do, Chair, if it's helpful, is go away and pull some information together for you and circulate that to you as an action for us, if that would be useful.
Yes, I think so. I mean, I don't, with all due respect to Councillor Fazal, don't think that's the whole of it. I think it's also recognising that there are differences in different groups and different communities. And as you were picking up on there, Ben, yes, there are inequalities. And therefore we need to think about that as well, perhaps, and see if there are any issues which we need to address. Part of it may be the mix of officers that we have working in each of the sections. So perhaps we can have a think about that.
Yes.
Do you want to come back on any of that?
Yeah, just to say we can contribute to that. We've recently undertaken a workforce survey, which was based on some national guidance and but also based on questions that we've asked young people about what's important to them, and young people have said it's important that that there are staff working in frontline services who look like the young people who are from the similar backgrounds and population who've experienced some of the same issues that and we commissioned some work to pilot some representative recruitment to try and target recruitment of trainee education mental health practitioners from different groups, and we had some success in that, and we've retained you know, the mix of our workforce is certainly much more diverse than it was, so we can certainly contribute to
that'll be useful. Thank you. Good, thank you. Any other questions on here? I can't see another hands up. I've got a couple.
Could I just come in, Councillor Evans,
yes.
just on the back of that, just to add to what Ben and Jo have said.
Yeah,
we've also, across children, young people's emotional health and wellbeing, we've commissioned a strategy, is a staff workforce strategy, and we got somebody in to produce that. So we'll go back through that strategy and have a look what we've collated, because that will give it on a wider spectrum to what Jo's saying as well. So there might be something in there. So as Ben said, we haven't got it to hand now, but we have got some information on there that could help provide some of that feedback.
Thank you. Yeah, thanks for that interjection.
Ben's put his hand up now, sorry.
Fire away, please. I've obviously set a cat among the pigeons.
Yeah, all I was going to say, Chair, is if you'll allow us, we'll bring a paper to you about our approach to inequalities for children and young people's emotional health and wellbeing, which will capture some of the things that are going on, both that Jo's mentioned and that Rona's mentioned, and some of the things that we've been doing in public health as well.
That would be very useful. Thank you. Appreciated. Yeah, I look forward to it as and when you can get to it. One's just very detailed little thing. We've talked about the increasing problems that youngsters are having in mental health. What numbers are we actually talking about? Have I missed that in the report there? Do we have a sort of baseline of numbers we have had to deal with and the numbers we're now dealing with?
Chair, I think Linda referred to a threefold increase earlier on, didn't she?
Is it 1 to 3, or is it 1,000 to 3,000?
I think certainly, sorry Ben, just chipping in here, certainly for us over the pandemic, you know, and I'll give you an example. I mean, obviously our crisis team covers Calderdale and Kirklees. Pre-pandemic, if we had a busy month, we were talking about 60, 70 crisis referrals. During sort of the last year, more often than not, month in, month out, we're talking over 100 crisis referrals. So these are young people have either turned up at A&E or have been, you know, deemed urgent referrals. With our eating disorders, again, they have doubled, and you know, literally doubled. You know, we would, you know, we're now seeing 10, 15, you know, eating disorder ones every month. Pre-pandemic, you know, it was 4 or 5, you know, but again, we cross Kirklees as well as Calderdale. But certainly one of the conversations I was having this morning is, and you know, as yet I haven't discussed it with Rona, but we have seen recently an increase in eating disorders in Calderdale. So now it's more like half and half for Kirklees and Calderdale, whereas in the past it's been more 2/3, 1/3. Now, again, this is only information that's come to me today. So what I want to do is actually, again, start to look at this. So, you know, we talk about partnership working, we talk about working in schools. I want to understand where, especially these eating disorder ones, are coming from. And, you know, could they have been picked up earlier? Is there something that we can be doing? But certainly, you know, like I say, I haven't got the figures, you know, and I'm sure Rona can provide figures for you, but certainly from a crisis and eating disorder point of view, that's, that is a definite increase.
I mean, I have to admit to being a bit of a data geek, but I often think, actual numbers do give you an understanding of the situation. So if there is anything we can produce in that sort of way, then I think that would help all of us understand the situation. Because as I say, if we've gone from 1 to 3, that's not good, but, it's not a major problem in itself. In that sort of context, we've not talked about, or we've had references to funding pots and things like that. Do we have a major issue funding-wise that's stopping us doing things?
I think Rona had a hand up for the previous bit, but she may also be able to.
Sorry, Rona, please deal with the previous.
No, that's fine. I was just going to expand, Councillor Evans. We agreed the decision was that we wouldn't focus on the figures in the paper that we sent, but we can share. We have a data monitoring group, so we do collect the data. We know that, as Linda has said, where there's some increases in her service, that there's a 50% increase in the first point of contact service. So we are seeing that increase across the board, really, and looking at that as we speak. So there are increases in all services really since the pandemic, and it's how we manage that and prioritise that. The money, we've got additional money that's gone in, as I said before, into mental health support teams, into schools. So our contribution into the services across the board has increased. We are in a position at this point in time of reviewing the demand since the pandemic and the level of service and interventions that we've got in place. So we've just undertaken a bit of a review on that, and that will be a discussion that we'll take into our Calderdale Cares partnership about have we got the right funding, right levels of funding for this service. It's obviously it's about partnerships, and our conversations going forward now are very much about how do we do this as a partnership. That's the world that we are in, and it's about ensuring that we have the funding in the right place. We want to do a lot in that preventative bit and that early identification, and as I said, that's why we cleared some of the waiting lists in those areas. It's really key, but so is the other side of the spectrum as well, so where people are waiting to access services. So we have to try and make that fit. But we have done a review because it probably been 3 or 4 years since we've reviewed our investment against the increase in the demand, etc. So we're in that process at this point in time.
Okay, I mean,
but I would say nationally against national, regionally, we're not an outlier on our funding. We're not an outlier that we underfund services for children and young people.
Okay, thank you. I say I'm not. It's not really criticism about the numbers. I'm just saying it would be good in the future to have some. Ben, you wanted to come back on it, I think.
That's fine.
Yeah, as Rona said, one of the decisions we made was not to go big on the data side, and there are some caveats around the data, I think. So an increased number can mean that we've got increased incidence. It can mean that people are being referred better, and so it could be a good thing or a bad thing. So it's a tricky picture, and so I suppose there's a note of caution around looking at the figures in isolation, but do think about some of the wider issues around actually the first point of contact has been really successful. It's probably stimulated demand, and Joe's talked before about that demand may not all be appropriate, and that's the work we're trying to do to ensure that we meet the needs of the children, whatever their needs are. But certainly, I think that has certainly led to more referrals because people understand that is a first point of contact, and we didn't have that previously. So just a word of caution really about the data, and I think we can provide some caveats with the data when we share that, probably.
I hear what you're saying, I know what you're saying, yeah, thank you. Final question from me is a bit in the data thing again. We've got sections which say things like families with young children want to be heard, families with school-age children don't know who to contact, schools struggling to navigate the local system and so on. We've talked about that, and you're doing work in those areas, which is good. it comes back to me and the data thing. I always feel more comfortable if we've got sort of, can we put any numbers on any of that? You know, because obviously we're aiming to improve the situation where young children are heard, more children are heard. We want to ensure that more families and children know who to contact. How do we know whether we've improved those things apart from hearsay, if we haven't got any data, any baseline or progress or dates by which we achieve things? That whole sort of area is one which I think is worthy of some assessment, some information. Clearly it's not in this report, it wasn't asked for, but I think it's something we need to be aware of. Am I asking for the impossible?
No, I think there's something around, we gather qualitative information as well. So how have people their experience of services? It's not just around the data. So we do gather that information, and we do some of that wider involvement with young people and parents to gather some of that information. We work closely with the Calderdale Parent Unique Ways, which is parent and carers, and they do surveys out into the system once a year, and they come back and they relay that and share those outcomes with us. And that's where we pick up some of the things that we need to do to improve our systems and our communication with people. It is hard, like Ben said, it's really hard to understand whether you're making an improvement, because are people being re-referred into the system, or is it a totally new referral? We don't know. Some of the services are anonymous, so it's hard to understand, like Couth, what the outcomes are, but we get quotes and we get information back from those services about how they've helped people and the lived experience of those people, and the input that they have had. So we do gather that information as well as the data. Yeah.
Okay, I think one or two people are having problems with connections at the moment, and I was just assuming they were getting bored and going away. we seem to have lost a few people. I think I've gone through my questions. I don't know whether anybody else has got anything else they wish to contribute or question at this point before we move to our final agenda item. And Lauren is reminding me that turning off videos does tend to stabilize connections. So it may well be that people are doing exactly that and being very practical and sensible. But I can't see any other questions coming up on this one. So can I thank all of you who came to this presentation, all the officers and people from outside organisations. It's a very good piece of work, a very interesting, fascinating piece of work, and quite frankly, I could spend the next couple of hours talking about it. We don't have that time, and I'm sure we'll pick up some of the other points as we go along, and you've got some bits to feed back to us at a later date. So thank you very much for your contributions and for the quality of the presentation and your answers to listening to us and being grilled. It's the critical friend that we hope to be. But thanks very much for all your contributions. We'll move on to item number 6, I think it is, which is, yes, the future work that we're going to carry out. Lauren, can you speak on this one? Your speech at the moment.
I can, Chair. I think, yeah, I've done too much talking the last couple of days, so sorry if my voice is trailing off a little bit. I think just because we're losing a few people connection wise, we'll do this back to front if that's okay. First and foremost, Mike emailed everybody about the equal care working group that we're going to be doing. That's going to be a joint piece of work between children's and adults, and we just needed the board to formally agree that those members that have put themselves forward happy to be on the working group. So that's Councillor Evans, Councillor Durrans and Councillor Fazal.
I'm happy to carry on with that.
if we can just propose and second it, Chair, that would be great.
Oh, right, okay. Who can Diana, can you propose it, as I'm one of the...
Yes, I will happily propose it, second it or propose it, whichever way round.
I'm happy to do either as well.
Lovely,
Right.
thank you. That's great.
Diana, propose.
I'll
Helen,
propose, yeah.
thank you very much for that.
Lovely.
All those in favour? Excellent. So we're sorted on
Great,
that one.
thank you.
Lauren.
And just to outline a few proposals regarding the work programme, I did email members about this, but we've got 2 new items on there. One's around the front door, so the children's social care that we're building in for December. Members haven't had sight of that this year, so we thought that would be quite useful. And then the Children's Safeguarding Partnership annual report will be due in March. So that was just to confirm that. We've also had a bit of a reshuffle around. So we're combining the Starting Well and Family Hubs item in December as they're one and the same. And we moved the EHNA from early March to late March. That's just to enable another public health focused agenda and to make some more capacity early March for you, because there's quite a few items on that agenda.
Yeah.
Sorry. And Ben also mentioned about the school nursing and health visitors item tonight. We've actually put that in for the new municipal year, but if members would like, we could build that into the end of March with that public health agenda. So you'd have 3 items on there.
I think
So
that's
just to okay it all, if you really.
not a major item in itself, is it? But it's part of it. I mean, do board members have a problem with that? We add that in and we're comfortable with it? Can I add that in? Good. Right, let's add it in. Yeah, I got a few thumbs up.
Thank you. I'll update it all and I'll send it out to everybody involved tomorrow so that you've all got the most up-to-date version.
Excellent.
Thank
so
you.
I think we've probably finished our agenda slightly early this evening. I'm pleased to say for those of you who've been here, but thank you all for your input. A very interesting evening, and look forward to seeing you at the next meeting. Thank you very much, one and all.
Can I just say,
I missed you, Diana.
But I was just going to say, could we just say a huge thank you to Lauren for all her work with CYP?
Oh, yes. I've done that. But yeah.
And a good luck for the future.
Yeah, you're right. Yeah, absolutely right. What a wonderful lady. We are going to totally miss her. Well, I certainly am.
Thank you very much. It's been a pleasure.
You're very lucky to have you, Lauren.